afternoon, Georgina. My name is Yvette Gillin, and today I am presenting the impact of the shortage of PPE on patient care. This is for clinical governance NUR3004. So basically, my background idea, as seen on the poster, is how the shortage of PPE, also known as personal protective equipment, how patients on contact precautions were being denied of receiving a high level of care, which resulted in poor health outcomes. So I'm just going to read you through the poster, my key ideas. However, I will upload a copy of this poster on Canvas so you can zoom in and have a bit of a read yourself too. So essentially, one aspect of improving patient safety that I witnessed on my placement at Epworth, Richmond, as a student was rounding. So what is rounding? Rounding is when the nurse goes into the patient's room, assesses their state, such as are they asleep, are they awake, is their call bell in reach, do they require an aid to ambulate, if so, is that aid close by? The nurse would also ideally assess the patient's vital signs, ask if they are in any pain or require anything such as water, something to eat, etc. It's also a chance for the patient to familiarise themselves with the nurse that is looking after them for their shift and, familiarise themselves. So, on my placement in a morning shift, I observed rounding to only occur when bedside handover took place and again changing at the afternoon shift. Hourly rounding only occurred for patients who were not on contact precautions. It is considered best practice for hourly rounding to be done for all patients as a primary mechanism to address basic needs and enhance patient safety during their time as an inpatient. So this should be done for all patients regardless if they're on contact precautions or not. So there was actually a study done in 2015 at a hospital in Michigan, United States, where a study found that rounding also prevented patient falls, reduced patients' need to call the nurse, and there was also a decline in pressure injuries and overall a staggering improvement in patient satisfaction as an inpatient. So during my time at Epworth, rounding was done well to an extent. Some barriers that prevented hourly rounding were lack of staff, patients, higher care need patients, poor time management and unexpected interruptions such as new admissions, which require a lot of paperwork, as you would know, and phone calls. However, the most significant issue that prevented hourly rounding for those patients on contact precautions were a lack of PPE. The shortage of PPE and its cost were also contributing factors. So now we're going to discuss the human factors. So for clinical governance to work, it is like a 3-step process. So it's the individual, the team, and the organisation. So this includes the patient, the nurse, and the organisation, so the hospital. So the overarching human factor that contributed to this issue that I experienced was not the organisation's unwillingness to provide the necessary PPE, but that we are living through a pandemic and there is a shortage of PPE worldwide. Due to the lack of PPE, theatre equipment was actually used, so that included hospital gowns and masks. These gowns were $100 per one that we used. So the other human factors that could also be taken into consideration were patients' ability to communicate their needs to the nurse and the nurse's competency and commitment in wearing PPE. However, I did not observe either of these factors regarding the patient or the nurse. So now we're going to talk about risk management and how to improve these and with strategies. So it became apparent to the ANUM that when he was checking the rounding computers that these patients on contact precautions were not getting, their hourly rounding was getting missed every hour. So this is a really big issue. So we had a meeting. So we had the ANUM, the nurses on that ward, which was 6th grade, and a social worker, and we all came together collaboratively and discussed ideas on how we can deliver high quality care to all patients, regardless if they are on contact precaution. So the ANUM decided a strategy that we will just designate one nurse to the contact precaution patients, and that nurse can be regarded as a specialty nurse. So that meant the buddy system was a little bit altered, the nurse to buddy ratio. However, it ensured all patients were receiving hourly rounding and experiencing the benefits of best care. So essentially it just meant that instead of having, a couple of nurses coming in and out throughout the shift, they just had this one nurse. So that meant that one nurse would only wear the PPE and that one nurse is only coming in and out. So lots of PPE wasn't being worn, essentially to save the equipment. So now we're going to discuss how does this interrelate with teamwork and communication. So communication is a really big part in a healthcare setting. So it can be seen everywhere from bedside handovers, communicating with your buddy nurse, engaging in conversation with patients. But as previously stated, the most significant communication that I saw at my time on placement was when we all had that meeting and we met together to discuss how we can deliver the best care to the patients on contact precautions as well. This is also teamwork. So teamwork comes into play because the Epworth nurses displayed excellent communication and teamwork in difficult and stressful times. So we all worked together. The ANUM was kind of like your leader in this situation. So he instigated the best possible outcome with the resources such as staff availability and equipment. So now, if this intervention did not take place, the patients could become more unwell and the organisation, so Epworth, is potentially at risk of getting sued. So our way around this is increasing the nurse to patient ratio. So although that is more expensive for the hospital, it will put nurses under less stress and allow high quality care to be given for every patient and prevent possible further deterioration. So this also comes into play clinical governance and strategies, and the principles involved. So I've listed all the principles and strategies here, but I think two that resonate most are risk management and clinical audit. So I've listed how and why I think they are best, and I've also got listed your principles. So I've chosen out two and described why and how I think they relate best to this scenario. So we've got effective planning and resource allocation. So I believe that Epworth do this by running regular training sessions that educate and remind staff of best practice such as wearing PPE and wearing it correctly, and continuous improvement of care. So I thought Epworth followed the continuous improvement, as when the ANUM became aware on patients and contact precautions, we came together and addressed this issue so that we could help these patients. So this represents the healthcare team, so like the social worker, the ANUM, the nurses in charge, and then like the governance, leadership and culture are also coming into play. And then we also have the meeting and the PPE. And then we have the APA 7th edition referencing here. Thank you for listening, Georgina.